grasp education with both hands. We should be looking at evidence-based practice, and we need to understand how to ask those questions to get the best out of that care for that patient. I'm Kirsty. I'm a Bariatric Product Specialist with Medstrom. To be honest, I think it's one of the most important factors is to have good education around delivering high quality care to plus size patient groups. If you haven't had that education around what is dignified care and how does it feel to wear an empathy suit and to put clothes on and to struggle with repositioning in bed, how are we actually advocating for the care of that patient? We talk about evidence-based practice in everything that we do. It should be exactly the same when it comes to caring for this group of patients. Medstrom bariatric roadshows have been so successful. Clinicians absolutely love them. When I'm delivering these educational sessions, I always make it very clear that these sessions are a safe space. We're providing them education in the areas that they need, dignity, stigma. We're even looking at statistics for their area, as well as educating them on equipment choice. Take that back and educate staff within your own trust or your health board to ensure that we're meeting the needs of these patients moving forward.